Good afternoon, everyone, or it might be good morning, depending on what time zone you're in. I'm Judy Griffith. I'm with Altran Health Services, and I'm proud to be your host for this great presentation called Improve the Patient Experience by Supercharging Your Scheduling Staff. And we are broadcasting from beautiful Frederick, Maryland, which is about 45 minutes outside of both Washington, D.C. and Baltimore, Maryland. You know, in the era of value-based reimbursement and the emphasis on the patient experience and how that will reflect your reimbursement through the surveys that they complete at the end of their care, it's ever important that that first experience be a positive one. And where else best to have that first experience would be in the scheduling area, when they are scheduling their appointment or appointments with their appropriate providers. So we're very happy to be able to provide this webinar that really talks about a case study where there was a challenge, where there was a solution, and then what the outcome was. Next slide, Mark. At Altran, we started webinars back in 2015. We always like to have, informative and timely topics. And when we're doing webinars or roundtable discussions, we like to have industry experts, just like we're having today with Tony Yanni and with Bridget, per year. And the recording today will be posted on the Altran website. And we also will be emailing the presentation to each one of you later this afternoon or even tomorrow morning. You will have the opportunity, and we encourage you to submit questions during the presentation. I will be keeping an eye on those, and we'll be facilitating getting those questions answered by our panelists. And also during the presentation, we will have polling questions, which we would like for you again to participate as we go through the presentation. And again, my name is Judy Griffith. I'm the Vice President of Account Management with Altran Health. I've been in the healthcare revenue cycle area for over 20 years. And I manage 30 of our clients, mostly in the upper Midwest and on the East Coast region. One of our presenters is Tony Yanni, and he is our Revenue Cycle Operations Manager with Altran Health Services, and he has over 15 years of revenue cycle experience with large healthcare organizations.
Hello. Yeah, as Judy said, I manage the operations for one of our scheduling teams as well as the business office in our self-pay group. Primarily work out of Minnesota, but we have clients throughout the United States, one being right here in Frederick, Maryland. In beautiful Frederick, Maryland, I might add. So if you've never been here, I encourage you to make a trip down here. And even come see Bridget, who is the next co-presenter.
Hi, I'm Bridget Purrier, Regional Director of Patient Access with Tri-Virgin Health Alliance, with over 25 years of revenue cycle management experience, and happy to have both Judy and Tony with me today.
So I just want to point out that this is our first webinar. I mean, Altran has been doing this for over 3 years, but it's our first chance to do a webinar. So please bear with us as we're kind of getting our stride a little bit. So Bridget and I are sitting right next to each other, kind of chuckling. So thank you.
And here's an overview of the agenda for the presentation and some of the topics that we will be going over. Altran has been in business over 40 years. We provide services from the very front end with pre-access, access, through to the back end. We have 2 centers of excellence within our healthcare division. One is located in Sartell, Minnesota, which is just outside of St. Cloud, and the other is in Gaithersburg, Maryland, which is about 30 minutes from where we are broadcasting today. All of our staff completes extensive training, have all the required certifications, and are continuously monitored for quality of their services. And we do have 127 and growing clients nationwide, which includes hospitals and large physician groups.
So as Judy mentioned, we're going to have, I believe there's 5 different poll questions, and it's really kind of for us to get a feel of where you guys are at and some of the scheduling problems and issues you face in the day-to-day. So the first quick poll is how many staff do you have performing scheduling functions in your healthcare system? Is it none? Nobody performs scheduling functions? Maybe it's outsourced. Is it 1 to 15 people, 16 to 20, 21 to 50, or is there more than 50 people? So please feel free to select an answer, and we'll give you about 5 seconds. Great. Wonderful. So it looks like 21 to 50. So yeah, we have 21 to 50 and then 1 to 15. So great, thank you. It's good to know who our audience is. All right, Mike, you can move on to the next slide. 7. So, what about Alltrans centralized scheduling? Well, we offer scheduling services to our different clients, and we really customize those services based on what their needs are. No client is the same, no hospital is the same, and each one has different expectations and different requirements. So in this particular case study with Bridget, we really sat down to understand, what are Bridget's needs? What is she looking for? What are her goals? Because we want to not just be, an outsourcer, we want to be part of her team, and we want to give her honest, accurate, timely feedback on what her expectations are, if we can meet those, and where we might stumble. So Bridget said, and we were able to provide improved call handling, increase the average speed to answer, and decrease her abandonment rates. And you'll notice as the slides go on, this was a really big goal for Bridget and her team to meet. And again, we are flexible. We are flexible with your business hours and needs. As an outsourcer, and I'm not necessarily a fan of the word outsourcer, but as a partner with your organization, we really want to come to the table and understand what you're looking for. But again, our staff, our teams are dedicated service representatives, and we have designated management and support designated for that staff. So we won't train one of our team members on this project and have them work 3 different multiple projects. We'll have them designated to your specific area so they know exactly what your goals are. And so why should you work with a third party? Well, so we identified 4 main reasons throughout our information gathering. We wanted to increase patient satisfaction. Patients don't want to wait on hold. No one wants to wait for something. So, it was really important for us to not only reduce the call time or the hold time, because when we reduce the hold time, that makes for a happier patient, as well as increased physician satisfaction. If a patient has been waiting on hold to get an appointment scheduled, chances of them kind of complaining to their physician or provider are pretty great. And I think we all can appreciate that, we don't want complaints, but if we do happen to get complaints, we have to take an action on it. If there's one complaint that somebody brought forward, that means that there's probably 10 to 15 other people that have that same issue, but never bothered or didn't feel the need or comfortable to bring that forward. And this also flows into increased market share. Happier patients mean better experiences, and they'll, just like any business, they're going to tell their friends. I had a really great experience with Frederick. The care was great. I was able to call and get an appointment, and I wasn't on hold forever. The word of mouth spreads. And again, we were able to drill down to specifics. So, Bridget said, Tony, I want this data. I want to know what my busiest times were. And we were able to drill down using the data, as well as the data that her team had gathered, to say, okay, here's what we're seeing. Let's develop a plan and let's move forward. And then Mark can go to slide 11. Great. So here are just a couple of the major EMRs that we are familiar with. Epic, McKesson, Meditech. Again, these are some of the advantages of working with a third party. So yes, FMH or Frederick Memorial is on Meditech, but our team is also trained on Epic and some of the other systems. Specialties. We were just talking before the webinar began that each kind of specialty we look at as kind of their own kingdom, and each comes with different rules. And it's important for us to understand what their needs are of that particular specialty, as well as understanding what the needs of the patients are. And we also, provided relief for internal staff, and we can do that with yours too. Our break times a challenge for you, because then we can utilize our team as well as yours to flex during those times and times of PTO, vacation, FMLAs. And then, we can also use our team while you bring new staff on board and you're in that training period. We can be that stopgap. So I'm going to turn it over to Bridget, as she is more familiar with Frederick Memorial Hospital than I am.
So as stated earlier, Frederick Memorial Hospital, located in Frederick, Maryland.
Beautiful Frederick, Maryland.
I tell you, over the last 25 years, Frederick County's population grew nearly 40%, representing an increase of about 95,000 people. So to keep pace with that growth, the area's leading healthcare provider expanded significantly as well. So for many of our Frederick County residents, Frederick Memorial Hospital is synonymous with the hospital located on 7th Street. We hear that a lot. And what's really going on is that our facility, Frederick Memorial Hospital, is actually the hub of a much larger Frederick Regional Health System. Frederick Memorial Hospital is recognized among the top 5% of hospitals nationwide, and we have nearly 2,700 employees. And we're one of Frederick County's largest employers.
And I will add in too, this morning we got a chance to meet with the CFO for Frederick, and I kind of sat in the lobby for a couple of minutes, and I was really impressed with, the flow. And it wasn't, you're a big facility, but you still have that personal touch. And when I saw that, especially with the surgery check-in, I was like, this, you've done something very good here. So I commend you and your team on that.
We pride ourselves on that.
You should. And then we can go to slide 13.
So how did it all start? It starts with the vision and defining Frederick Regional Health System's consumer strategy. So we defined the priority consumer segments. And for us, that was chronic conditions, pediatrics, mothers, healthcare decision makers, our geriatric patients, generally well population. Mm-hmm. And based on that information, we were able to confirm our segment-specific strategic priorities: market growth, growing market share, improving experiences, enhancing continuity of care, improving operational efficiencies and reducing costs, driving innovation. And for there, as you see, we have highlighted, we were able to outline tactics in support of those strategic priorities. So improving experience, we wanted to focus on our financial application, scheduling, expand patient visit portfolio, enhancing continuity of care, patient navigation, provider connectivity, telehealth, transportation, and mobile care. So it was really important for us to incorporate the voice of our consumers via focus groups, running concurrently with the planning process. So
I personally really like this slide. I like the 3 pillars because you're able to bring it from a very high level on the left and really drill down to what are the 2 focus areas. Mm-hmm. So I really appreciate this slide. So very good work.
Thank you to our senior leaders.
Yeah, thank you for all of those for that support. All right, we can move on to 14, Mark.
So as you can imagine, here at Frederick Memorial Hospital, we had our challenges, and we still have challenges, but our patient complaints was something we wanted to address. The patient experience, and we wanted to enhance continuity of care. Scheduling, we wanted to provide a consumer-oriented experience. Staff turnover, boy, I mean, we can all talk about that, but something else we were challenged with. Long hold times. I mean, some of our patients were holding more than 3 minutes, and we had an all-time high of abandoned call rate of about 23%. So we really had some challenges in front of us.
Now, Bridget, what is an industry standard for or goal for call abandonment?
Typically, what we see is about 5 to 6%, and in our industry, and when you're talking about a blended call center,
right?
So that number of 23%
was pretty high.
Yeah. And I will say, this is the other thing too about that call abandonment rate, because when we first started this project, when I came to Altran, Frederick Memorial Hospital, we've done the scheduling process and it works great. So I asked my team, I said, what do you hate most about scheduling when you call in to schedule an appointment? And it was really nice because Altran is, based in the United States. So we have kind of the same problems, So we took their feedback and said, hey, Bridget, this is what we got. What do you think? And from there, we were able to use our team's expectations and their consumerism to kind of drill down to say, yeah, this is right. And how do we solve this? So poll number 2. So we'd like to know, what are some of your staffing challenges? Are they unscheduled absences, sick calls, lack of quality candidates to fill open positions? I know in this really robust economy, that's some of the challenges that Bridget and I face. There's a lot of jobs out there. Or is it, you do have a full team, but is the work just kind of really monotonous? This is that staff burnout. Or is it covering lunches, breaks, and vacations? Or is it, a combination of all of the above? So we'll give you about 5 seconds to answer, and then we'll move on. All right, looks like 56%, all of the above. Yeah, absolutely. Unscheduled. So that surprised me a little bit with unscheduled absences. But that's good feedback. All right, thanks a lot. Then Mark, we can go on to the next one. All right.
So now it was time to change our approach. We had a plan. It appeared to be a straight path, but we found that more was involved. It required significant changes to our processes, our systems, and our infrastructure. So we had a consumerism goal that was out there, and we had to expand our scope. We had numerous systems that were barriers to our consumers' positive experience. How do we get them through this? How do we give them access to our hospital system? Our Meditech system had not been optimized in many years, and teams had become comfortable with inefficient processes. So we needed to make some changes.
Yeah, absolutely. And, I see a lot, even with my team too, you become comfortable with the process that you grow up with. And when I say grow up, that you're familiar with. And if you don't know any different, and if you don't continue to ask yourself, am I doing it the right way? Why am I doing this? Why am I selecting this? What does it do? I think that leads to, this is just, and I hate this thing, this is how we've always done it.
Absolutely.
And I think number 4 was one of the things that you pointed out. It was just, my team, good, bad, or otherwise, this is all we know. So we can move on to 17.
So our number 1 priority in our initiative was to complete our consumerism initiative. And the key component to that was, first, stabilize scheduling and our call center staffing, maintain a 2% abandoned call rate. And you're probably saying, where did that come from? But that was one of the goals that came from this and from our CEO wanting us to get that abandoned call rate down.
Do better than the average.
Absolutely.
Yeah.
Absolutely. We wanted to continue our process improvement for access and imaging, so we created some teams around that. Optimize our current online patient pre-registration and explore patient portal opportunities.
Yeah.
So this was our priority, and we moved forward with it.
And now we have poll number 3. Does your organization use reporting metrics to monitor your scheduling staff? So when I say monitor, production, quality, that kind of thing. Yes, no, or don't know. And it looks like there's a little typo there, so apologize for that. Great. So the results
are in.
Are in. Great.
Wow.
One to hear. So 25% of you don't know. Well, that would be interesting to find out how you monitor your call center team. All right. Thank you.
So when we started our process and gathering our data, we found that in our fiscal year 17, our call center had, our current year 17, 159,104 calls that came into that center, which came out to be approximately 600 calls a day. Our abandoned call rate then, 23%. Our staffing, 6 people. Now, we weren't staffed for 6 people. We had a budget of 11. But what happened was, because of absences, FMLA, turnover, that's the number of people we had when we started. Time on hold was about 4 minutes. Today, we have a 2% call abandon rate. We have 15 people that are budgeted and scheduled for this area, and our hold time is 15 seconds. Absolutely amazing.
Yeah, night and day. That's great.
So, Bridget, people are probably going to be asking or wondering, now you're at 15 people, choosing an outsourcing partner for this. Was it expensive?
Yes, it was.
Good. Absolutely.
And it wasn't something that we were prepared for.
Sure.
But we recognized that we had a need, and in order for us to meet this goal that was before us, we needed to do something, and we needed some help.
Yeah. Yeah.
And when did you start the project?
Our project actually started in January of 2017, but we started working with Alltran in about May of 2017.
Yeah. Okay.
And so here are our call abandonment rates for the last fiscal year. We started doing well, but we needed to hit.
Trust us, in January 2017, it's
right.
like 23%.
Right. Please do. But we worked hard, but we knew we needed help.
Yeah.
So 4%, and here we are today.
And I think that everyone who has a scheduling team can understand that summers are challenging, and you can kind of, and also holidays, so you can kind of see an uptick in December and January.
Yeah.
For those, and I can say, and Bridget, feel free to disagree or agree that without having Alltran staff to kind of supplement your team, they would be much higher.
It would.
Yeah.
It would be.
Now, does that mean that Alltran does not give their employees time off? Absolutely not. But working together and really establishing and looking at schedules, either unplanned absences or planned, we were able to really drill down and work cohesively with with your teams as well as my team, staffing for those particular days.
Yeah.
And I think it's important too to also point out, we started with 6, and now we're down to 2.
To 2. That's absolutely correct.
Right.
And
so although it's expensive, it got cheaper.
And we appreciate the flexibility
Wonderful.
and allow us to scale down as needed. But we took a lot of our data, we built reports, we captured the number of calls presented, the average wait time, the abandoned call time, and we had a even further aggressive goal. So normally we see a 30-second call abandoned call rate. we reduced ours to half that amount, to 15 seconds,
Great.
which is very aggressive.
And I want to just point out too, this is an average of a year's worth of data. So, so Monday through Friday, we've taken that year's worth of data and averaged it and said, okay, here's what you get. Here's the average.
Right.
And you can see that, 3%, there's no red, yellow, green. When something goes yellow, to me personally, that's red. That's a problem. It's not green. So that's where you can see it's red when it goes to 3.
So we were able to determine our peak times, our high volume days, which were Mondays and Tuesdays. And even since this time, this number has changed tremendously.
Sure.
I mean, we've had record days, a Monday of 600 plus calls, or so.
And to me, the more calls, that means that Frederick is growing and doing a great job.
And more people are reaching out. They can get to us and they want to schedule their appointment.
And I want to remind everyone too that you feel free to ask questions, anytime during the slide through the chat option. So I believe this is one of the last polls. Maybe there's one more. So what are your most challenging scheduling days? Is it Mondays and Tuesdays, Tuesdays and Wednesdays? Is it Wednesday and Thursday, or Thursday and Friday? So we'll give you about 5 to 10 seconds to select an answer, and then we'll look at the results. All right. Mondays and Tuesdays.
Yeah.
So to me, this is not surprising at all.
Exactly. I feel the same exact way. Not surprising at all.
In fact, when we threw the polling questions together, and Mark, feel free to go on to the next slide. When we put the polling questions together, Bridget and I both said, I bet everyone's going to select, or most people are going to select Monday and Tuesday. So, what kind of technology do we have at Altran to assist, Bridget in meeting her goals? We use something called Artiva Health Systems, built by Ontario Systems, and this is an inventory management system. We also use Avaya, which is our telephony platform, and this is something that we were able to do some call monitoring on, watch those average speed to answer times, as well as the average talk time. And we have advanced fast analytics with reporting, so we're able to drill down to get right down really to the second, and find out exactly what hour of the day, what 15-minute increment of the day we're able to staff. And Altran is very big on our quality controls. We continuously perform risk assessments and make sure that our staff are HIPAA compliant with annual and biannual annual testing. Thank you, Judy. And for us, this is one thing that I'll put, say for anything. It's important to have a downtime procedure or just disaster recovery plan. We were just chatting yesterday that, you don't really look at those downtimes or disaster recovery plans until you need it. And then sometimes I know that I've been in this position where it's like, oops, I didn't do this for 3 years. It's a little out of date. So if you haven't done that, just pull it out and take 30 minutes just to go through it again. So, at Altran, we do have a backup plan for, what happens if Bridget's phones go down or our phones go down. How can we handle that and how can we flex staff? We can move on to slide 24. And this is just, and I'm certainly not going to read through the whole slide, but this is just some of the training that we have our team do. So just because they're on scheduling doesn't mean they don't need to be aware of what revenue cycle is and how they impact it. So to me, and people may argue, the first part of revenue cycle is in the front, obviously. But then, if you don't put the right information in the front, it's not going to come out the back very well. So we want to make sure that our team is really educated on the entire revenue cycle. So these are just some of the things that we train on. And we have a robust, career pathing process as well, where a lot of these things are involved in that.
Right. And we were fortunate to be able to help create some of these training tools as well. Some of these items are items that we trained our staff.
Yep.
We want your staff to have the same experience.
Yep.
So
and, at Altran, it's not just about, we'll tell you what you're doing wrong. No, nobody's perfect.
Right.
So we may not be doing something as good as maybe we can be. So that was what I really liked about partnering with Bridget and her team, is there was this open line of communication, and Bridget said, just if you find something, bring it forward right away. Don't feel, intimidated, or don't think that you're going to hurt my feelings. And, I appreciate that, so I did the same. So we can move along to slide 24. So again, my personal feeling is quality is more important than quantity. Yeah, you can push out a lot of phone calls or a lot of claims or what have you, but if the quality isn't very good, you're going to rework on that, and the unhappy patients are just going to increase. So we monitor our quality a couple of different ways: by their activity reports, side-by-side observations, so that's active call listening right there next to someone. So we can, ask the representative to put the patient on hold and say, you know what, let's take a different approach. And we also remote in sometimes to, and this is a very big brotherish to me, but you know what, it works. It's to kind of, let's see what Bridget's up to today. Let me remote in and make sure that, it's not even about making sure she's doing something. It's about continuously improving her process. If her average average talk time is a little longer, well, what can we do to help Bridget? Maybe she's doing some things that she doesn't need to do. And again, just that management by walking around can be very helpful. And then, again, we share our best practices with Bridget and her team with all of our clients. And then, an annual performance appraisal. And I can say that, my annual performance appraisals, nothing in your performance appraisal should come as a surprise. So typically mine used to last about 15 minutes. And if, so I think my director really appreciated that. Anything to add, Bridget or Judy, on this for quality assurance?
It's important to know that we followed the same
absolutely
forms. We monitor our staff. We did the same thing. So
and we utilize a 3-point verification where 3 pieces of information are what we want to identify that patient. So we're very compliant with that. And then we can move along to slide 26. Great. And so on that kind of compliance train, everyone from the person who mans the front desk to our CEO is responsible for compliance. And, this shouldn't come as any surprise to any of us on the phone. If you have one weak link in there, it can cause problems. So that's why we continuously train on compliance. And it's not just a one-time-a-year thing for us. Things change constantly. So we like to say, and we strive to stay up to date on the latest changes. We like to get ahead of those instead of waiting, putting them on a survey or a question at the end of the year so people can learn them then. No, we want to jump in. We want to get in front of that train to get everyone trained in. So implementation. So this is a very high level overview of what happens when you decide to say, you know what, we need Altran here to help with our scheduling. I'm not going to talk verbatim through this slide, but basically it starts at the contract being awarded. And you set up those implementation meetings to understand what your needs are and what your expectations are. And then, of course, there's a statement of work. And then we want to become trained on your system. Again, we don't want patients to think that they're calling Altran in Minnesota instead of Frederick Memorial Hospital. So, we've gotten really great feedback from patients where they have no idea that they're talking to somebody who's not in the hospital doing that scheduling. So, to have that seamless transition is really important to us. And then, after we feel the staff is trained, we go live.
Bridget, for your implementation, for your project, how long did it take?
Again, we had a very aggressive schedule, but we were up and running within 60 days of our implementation. I think our biggest piece to work through was the connectivity of our phone systems, because you were all on one phone system and we were on another, but we worked it out, and it really worked out very well. That was a very quick implementation.
Yeah.
So as a result of partnering with Altran, we saw improved call handling, not only for Altran's team, but for FMH staff team, our schedulers.
And I'll chime in right there.
Sure.
And we're in the same queue. So you know what, Bridget's, free to go up to her board and her scheduling center and say, what are those? I wonder what the Altran team is doing today. Why are they in Ox for 30 minutes? What's going on? So, we wanted to create a lot of transparency. So, there's times where Robin or Danielle will reach out to us and say, hey, is there a problem? We noticed that. So, and we do the same for her team too. So it's, not only increased staff, but it's also that increased level of management too that can be helpful as well.
Absolutely. And partnering, doing that, it was great.
Yeah.
We also had the ability to customize call through use of our telephony technology. So there were calls that we didn't want Altran to work on. And our physician practices, for example, we could separate those calls that they all came to FMH and our scheduling team took care of that. But having that ability to customize the calls that we wanted handled by Altran, that was wonderful. We reduced our hold times. There was now stability in staffing, so where we had gaps, Altran was now able to fill those spots in. And we just had a positive patient experience, which was very important to us. And even more importantly, the partnership that we've created with Altran has been wonderful. Lots of teamwork, our reporting, we see each other's reports, we know what we're doing. It's been just a great work together all around.
Good. I feel the same way. So, Judy, I can do it? All right, so we want to keep the conversation going, because as much as I like to think I know everything, I certainly don't, and I leave it up to Bridget and Judy to tell me that. But, if you're interested in learning more about, Bridget's challenges and working with Altran, feel free to reach out to her with an email, as well as myself. If you want to talk about, let's investigate more. I want you to reach out, or feel free to reach out to Judy Griffith, and her phone number and email address are there. But, let's keep it going.
And this concludes our webinar. We hope you have gleaned some golden nuggets, if you will, from it. As a reminder, we will have the copy of the recording on our website, as well as emailing a copy of the presentation out to you. Again, thank you very much for attending, and hope to catch you on the next Altran webinar. Have a great afternoon. Talk to you soon.